Hi friends, I am Dr. Harish R J. Fever, also known as pyrexia, is one of the most common presenting complaint in the clinical practice. Fever by itself is not a disease. It's a symptom which makes a patient or a person to come to the clinic. And when do you call a person is having a fever? When an individual's temperature goes beyond the normal range of temperature, excluding the physiological conditions that make his temperature to go high. For example, a person has done an exercise, his body temperature has gone high, but it's a temporary rising body temperature, and when he relaxes for some time it goes down to his normal range. Excluding these physiological conditions, if the body temperature goes beyond the normal range, then a person is said to have fever. Hypothalamus sets our body temperature and maintains it within the normal range. Whenever there is a pathogenesis, whenever there is a kind of inflammation inside our body, pyrogens are released inside the blood, and these pyrogens travel in the blood to reach the hypothalamus and they reset that body temperature to a higher level. Now your body temperature is not set within the normal range. It is set at a higher level and hence fever. So Ms. Dhanushri will explain you how to measure this body temperature using a regular digital thermometer, which can be used as a household equipment to measure the body temperature, or you can use an infrared digital thermometer if you are using it in a mass wise, because you may not need to clean it every once and then. There are various causes. Mainly it is infection. It can be either bacterial infection, it can be either viral infection, it can be either parasitic infection. Most of the time it is usually the infection that causes fever. Other causes include, it may be because of clotting disorders, it can be because of cancer, it can be because of autoimmune disorder, or you can classify it as miscellaneous. So when do you have to worry if there's a fever? Low temperature fever may not say that you are safe, and very high temperature there is no need to panic. So the level of temperature rise will not usually indicate the severity or the prognosis of the fever. The moment you have fever, what are the first things, basic things that you need to do? Because of fever, you may sweat a lot of water. Your entire body sweats. So you are obviously dehydrated. Having plenty of water will give you some kind of relaxation. Mainly it is paracetamol or acetaminophen. If there is too much of body ache, take some mild analgesics like ibuprofen or aceclofenac or diclofenac. If it is a child, if it is a pediatric age group, then the normal dosage will be on per kg body weight. About 10 to 15 milligrams per kg body weight is a normal range of the dosage for paracetamol. What it does is, it makes disease-causing agents inhospitable inside our body. The moment your body temperature is set at a higher level, it becomes difficult for the pathogens to stay inside your body, and hence it moves out. Other than this, the root cause for the fever has to be identified and treated accordingly. For example, if there is an infection from bacteria, treat the individual with antibiotics. If it is parasitic infection, give him some anti-parasitic. If it is fungal infection, give him antifungal. The symptom of fever is not just rising temperature, it may be associated with other qualities. For example, it may be continuous fever, it can be intermittent fever, it can be associated with chills, it can be associated with rigors, it can be associated with headache and body pain, or it can be associated with systemic diseases like an individual may have sore throat, he may have cough, he may have pain abdomen. By mixing and matching different kinds of symptoms and signs, we may clinically arrive at the diagnosis as root of cause. In addition, you need to do some investigations like blood tests, urine investigations and those kind of things. And finally, you can arrive at the diagnosis and later on manage the case of fever. I hope you like this video. Please do subscribe, share and comment. Thank you. Thanks for the support.